May we move on then, please, to item 3 on the agenda. We're about to take 4 of our critical success factors in turn and to review progress and think through the implications for the board overall. The first of them is resourcing the board and a paper on recruitment strategy with Joanne Wass.
Thank you. Thank you. This paper provides a stock take to the board on where we are with the recruitment strategy. We've talked about the recruitment strategy at previous meetings, but this is the first stock take point. The first point we said we would review that strategy was the end of June. So this provides a review of where we were at the end of June. That's when the paper was written. The numbers are a little bit out of date, and I'll update them as I go if that's okay. So what this is about is how the board fills all the posts that it's got in this new organisation by the end of March 2013. You'll notice that the paper talks about the board having approximately 4,000 jobs. As we're kind of firming up the structure, we're sort of clarifying that figure. I must say that figure doesn't include FHS staff, and Ian's team is doing some work to look at how many people that involves, but there will be FHS staff on top of that 4,000 figure. The other thing I'll just say for the benefit of the new non-executive directors, and apologies to everyone else because I know I'm repeating myself quite a lot on this, but we are one of the new receiving organisations. So there are lots of new organisations being created, as you know, within the NHS system. The NTDA, Public Health England, Health Education England, and there is a system-wide agreement to a set of HR rules that we kind of all operate within. Neil McKay, who's the Chief Executive of Midlands and East SHA, leads that work on sort of overseeing those system rules. And one of the stated aims of those rules is to minimise redundancies across the system. So there are 38,000 staff in the NHS affected by these changes, and the way that the HR rules are structured is that we will look at those staff first and give them, the staff that are affected by the change or at risk of redundancy, will give them the first chance at opportunities in the new organisations. That's why sometimes you don't see our jobs advertised. I've seen a few comments in the press about, oh, you seem to be filling jobs without advertising them. They are advertised, but they're advertised to staff at risk and staff affected by change. You won't necessarily see adverts in journals and whatnot. So a high-level timetable was agreed across the system. So all the new organisations are roughly working at the same pace, so that the 38,000 affected staff can see all the opportunities that there are across the system roughly at the same time. And we've talked about that timetable here before. We're making reasonable progress in the sense that we've now got a complete board. So we've got all our national director posts appointed to, we've got all our non-executive posts appointed to. To press, so today I can tell you that we've recruited to 47 VSM posts, very senior manager posts in the organisation. We've pretty much now completed our high-level design of the organisation, the structure. We haven't gone down to every single level of job, and that's the next thing we need to do, and we need to do it quite quickly. And we need to write job descriptions and person specifications for all those jobs. We've also transferred in the staff from the NPSA. There are 28 staff from the NPSA that we transferred in that we discussed last time. And at the same time, we've got an OD strategy and development to help us build the organisation. But it's true to say we are a little bit behind plan, and I guess that's something we might want to talk about. So the VSM recruitment has taken slightly longer than we expected for a number of reasons. Ian may want to come in and say something about this, but one of the key reasons is that we took the decision to revisit the number of local area teams that we would have. So if you remember, at one point we were talking about having 50, and Ian led a piece of work together with PCTs out in the system and other colleagues to look at whether that was the right number, and we decided that 27 was where we were going. So that has taken a little bit of time, and it's put us back slightly in terms of the programme. We're also finding some of the process a bit difficult, and it's taken us quite a long time. So some of the work around evaluation of the manager jobs, the VSM jobs, is taking quite a bit of time. Some of the conversations we're having with sending organisations about whether a function constitutes a transfer to the board or not is fairly time consuming. And if you don't fill a job at the first advert, it can be quite time consuming to go through the different stages of the process before you can get to a point where you recruit somebody. So we've revisited our plan in the light of that, and I think our conclusion is that it's extremely tight, hence we've classified it as a red risk this month. I think it's still achievable, but we have to do quite a lot to get us back onto track. So, and one of the key things is getting the managers in post. So once we have VSMs in post, we'll have more capacity to recruit others. And that's particularly the case, I think, in the regions and the local offices. So what we are planning to do is to agree a recruitment timetable with each directorate now. So we've had a high-level timetable. We're going to agree a timetable with each directorate, including each region within the operations directorate. We have a small central team that is just starting to struggle a little bit for capacity. So what we've done, we're going to do two things. One is we've partnered with NHS Employers, which is a near neighbour of ours in Leeds. It's part of the NHS Confederation. It specialises in promoting HR good practice to the NHS. So we've partnered with them. They've given us some capacity. They've embedded some of their staff with us, and they've procured some third-party support to help us as well. So that's one thing we're doing. The other thing we're going to do is I think we're going to localise the recruitment activity as much as possible. So we are going to delegate recruitment activity to the regions and the local offices rather than try and do it all from the centre. Now we realise that we're going to need to put capacity into regions and local offices to do that, and we're going to need to do some training for people who are doing that to make sure that we do it in keeping with the culture and philosophy of a single organisation. The other point that I try and pick up in the paper is to say, I think as we go through this transition, it's important we keep an eye on the metrics and particularly the impact on the diversity profile of the workforce. So through Neil McKay's work, we've got a really good picture of the 38,000 staff that are affected by this change. We've got very good diversity statistics for those groups. And I would welcome comments that people have got on the way that we might collect data going through this and the frequency with which we might do that. So the big things going forward, I think, to get us back in the right place are a big push on organisational design. So every directorate knows they need to finish their design work, they need to do their job descriptions and their person specs. We need to secure some further HR capacity. We are talking to Neil McKay about how we can streamline the recruitment processes, and we are continuing to work in partnership with trade unions. I think the inherent risk of this remains quite high, and we need to keep it on our radar, but I think we will come back to it again in September. In the meantime, we're working up contingency plans.
Thank you. You mentioned Ian in your presentation. If I could turn to you, Ian, first. Is there anything you'd like to add?
Yes, thank you, Chairman. Just to expand upon that, clearly the Operations Directorate is the board in the NHS, as we discussed at our last meeting, and because this is an organisation where most of our staff are out in the NHS, that means most of the staff happen to be in the Operations Directorate. I think we've made good progress since the last board meeting. At the last board meeting, we decided we were going to have 24 local area teams outside London and 3 in London, working under a slightly different, slightly more pan-London approach. Since then, we've gone out to advert. We're announcing today that we've recruited on the first round of recruitment to 16 of the 25 posts concerned. So that's the next stage. They will then be involved in recruiting the next tier down. So it does become a sort of a cascade process. So I think we are moving increasingly fast. But I agree with Joe, we've still got a long way to go because the magnitude of the Operations Directorate covering area teams in every part of the country, 4 regional teams and a very small team at the National Support Centre means we have an awful lot of recruitment to do over the next couple of months.
What sort of assurance can we give to those who we are hoping to recruit that this is a stable process and that we will be able to deliver? I mean, what's your level of confidence that we will be able to provide employment to those best suited to it within the time scale that we've set ourselves?
I think there's two issues there. I think one is the kind of confidence issue, one is the timescale. I mean, we will clearly get there. I think we will probably need to put some contingency arrangements in place for us to get there. I would say that for people who are sat out there in the NHS waiting to see our jobs, you will see quite a lot of stuff coming through, probably quite quickly, you know, once we kind of get the critical mass of managers in place to start doing the recruitment. And the best advice I could give to people out there is get your CVs up to date. If you're kind of looking to work in the board, get your CVs up to date now, get yourself in the right place, because I think once the jobs start coming, they'll start coming through in quite large numbers. At the moment, they're kind of dribbling through a little bit because we've got a small number of people doing the recruitment, but once we've got a lot more people, you'll start seeing jobs probably from about September onwards coming through in big numbers.
Moira?
Chair, this is an enormous task clearly for executive colleagues, and I can see why it would be treated as of significant risk. But I was interested in Joanne's comments really about the metrics, and I believe I read that in the downsizing of the civil service in general, women have been overrepresented in the departures, and but who would hold the ring, as it were, because we're not responsible for all of this. We're one of the receiving organisations. There are lots of others. But will there be an overview at some point? Have colleagues agreed that about what actually did happen, and will we see that in the future?
There's a really excellent tool that Neil McKay's outfit have developed called the People Tracker. And they've had a fantastic response rate to it. So 100% of sending organisations have responded and inputted data around staff that they feel are affected by the changes. So they've got data, absolutely detailed data on the 38,000 staff that are affected by the change. Obviously there's the odd gap in it because it depends on the raw data originally. But so we've got a pretty good picture of the 38,000 staff that are affected. And what happens now is that senders and receivers on a monthly basis are updating that, so we can see people moving around the system. And there's nationally there's an HR strategy group that's keeping an eye on that, and that meets monthly.
Could I add to that, Chair? So I completely agree with the importance of the issue, and there's some coverage today, interestingly, about potential reduction in black nursing directors in the service. And with my kind of new national role for inequalities, I'm showing close interest in it. So at one level, it's completely understandable. There are fewer directors of statutory organisations by some margin, and so therefore it is likely that on any particular group you measure, the numbers in absolute terms will go down. But we shouldn't use that for false assurance. So, for example, it appears as though one of the places where it's been relatively, and I say relatively, more accessible for people from BME backgrounds to get directors' posts has been in the commissioning system, and therefore they are at risk of being significantly disadvantaged as we downsize director posts in the commissioning system. So we will need to pay very close attention to our own appointment process and to the wider system. Otherwise we will be overseeing inadvertently loss of opportunity for people from a range of different backgrounds.
Victor?
I said the minority ethnic issue, it's not just nurses but the VSMs, how we do, because you have started recruiting VSMs, how are we doing so far?
Yeah, well, I haven't cut the data
actually,
yet.
Okay,
I haven't cut the data just yet, because what I'm trying to do at the moment is trying to work out how we're going to collect it and what sort of things we should be looking for. And I say at the moment we've recruited 47. Three were transfers and 44 were direct appointments. But the next stage is I need to very quickly start.
I wouldn't mind knowing where we are with that. Can I just make another point?
Yes, please.
On these VSMs are key culture carriers. As leaders, and I just wouldn't mind hearing a bit more about how we're going to ensure that we have leadership alignment, because you're doing a task which I'm sure we'll manage, but it's a really tough task, and each time we recruit a VSM, they've got to carry the new culture, bring it into the people that they recruit, and it's got to add value at speed.
I mean, Ian might want to say something about how you do that through the Ops Directorate, but there are two key interventions, I think, as far as I can see at the moment. One is everyone who comes into the organisation is having a sit-down one-to-one meeting with their line manager, and we're developing some corporate materials to aid and guide and steer that conversation. And the second one is we've established a leadership forum where all the VSMs in the organisation come together once a month on a regular basis in Leeds, where we get together, we talk about whether we solve problems together, we talk about whether we're enacting the values that we kind of espouse, and we generally kind of share and learn together, I guess. So I think they're the two kind of OD interventions, if you like, but I don't know if you want to say something.
Yes, I mean, obviously those OD interventions apply to the Operations Directorate as much as to the rest of the organisation, and we're very much keen to be part of that work. But the other thing that's worth mentioning, I think, is that, as we've discussed around this table before, you know, we are creating something that's distinctly different from the past. In the past, there were a range of separate organisations with their own geographies. What we're creating now, albeit that it's got most of its people out in the NHS in area teams and in regional teams, is a single national organisation. And so I think we're making very clear from our recruitment material, discussions at interview, and then working with the successful candidates when they're appointed and then start appointing other people, that they are being appointed to this new organisation, the NHS Commissioning Board Authority, rather than being appointed to individual fiefdoms, if you like, which to some extent would characterise the past. So I think the sense that we're starting off in that way, and we spent a lot of time talking about that, together with the OD interventions that Joe's talked about, gives us a chance of creating what we need, which is a sense that wherever you work within the country, you're working for this organisation and its really important purpose.
And the other thing I'd add to that is, I mean, it's also happening, I think, through the recruitment process. So Ian and I interviewed together for the regional directors, and a key part of the conversation at the interview was around that, wasn't it?
Yes.
Single organisational culture and all that.
And I would just add to that, broadly put, that one of my core sort of priorities at the moment is absolutely the development of a narrative for new employees, which will, I hope, provide a very real sense of engagement with the core objectives of the organisation being to genuinely transform the service and outcomes for patients, and a simple, ready articulation of that narrative, which I think is a great opportunity for the board and for all its employees, is something that is a big priority for us right now. So I'm hoping very shortly that will be available to people, and I think that's a very important part of this process of building culture is to articulate and very quickly distribute a clear sense of shared purpose through a simple articulation of the narrative that we should all support.
Okay, thank you. I think we're all conscious that this would be complex enough a process were we merely transferring people from one organisation to another, that we're transferring people from something like 160 organisations to one, and at the same time trying to do something quite transformational in terms of culture. Makes this far more complex than it would otherwise be, and the time in which we have to complete the task is very limited. We're asked on this paper to note progress, to endorse the timetable, which I'm sure we do, to endorse the proposed arrangements for monitoring progress via monthly reports. And could I add to that, if those reports could touch upon the equality issues that members of the board have raised this afternoon, that would also be very helpful to us. To note the resources and to note the risks and mitigations. It's something that the board will want to keep the closest eye on over the coming months to ensure that the process not only succeeds in terms of numbers but in terms of quality and culture. Maggie.
Just going back to your report on the numbers for a second, Joanne.
Yeah.
Of the 4,000 people that we're trying to recruit, how many have we actually got on board today?
So 47.
Right, so we've got almost 4,000 recruited.
Yeah.
900.
No, they've got slightly more than that actually, because I've forgotten the MPSA stuff. But yeah, we've got the majority of it to do. Yeah.
Is there any kind of risk that we have that in the race to try and get them on board in the time frame there's any compromise on suitability for the job or quality? And how do we safeguard against
I do think that's always a risk. So basically we've got the clock is ticking. We've got a set amount of time to do this, and we've got a lot to do in the time period. So one of the risks is always that you kind of compromise what you're looking for. I think our evidence to date suggests that we're not doing that. So we've been very clear about what we are looking for. In all the interviews that we're doing, we're not only looking for kind of experience and the right kind of knowledge and background, but we're looking for the right kind of values as well, and we've explicitly built that into the recruitment process. I agree with you, it kind of gets harder as you go along and the clock is ticking, but I think we are clear that we are going to hold the line on that.
So, Chairman, in the monthly report, can we get the numbers that are outstanding as part of the monthly report?
Yes, and I know that the board will constantly wish to have the reassurance of that answer you had to the last question about quality.
Yeah.
It's quality, getting the highest quality people that we can suited to the tasks which we seek them to undertake, but also bringing them in within this completely different culture. I mean, I think it's very challenging, actually, looking at it from the perspective of somebody who is considering where their future lies, to know that there is available here something that's suited to their talents, which will stretch them, which will be, I'm sure, an exciting, invigorating environment in which to work, that will be quite different from that environment in which they've worked before.
Sorry, just to add, I think that I've always been a great believer that a recruitment process is a two-way street. So it's not just about whether we think somebody's right, it's about whether they think this organisation is right for them. And I think the other risk in squeezing the timescale is we don't give people enough feel for what the organisation is like. So I think we need to be mindful of both of those things. Neither do we compromise on what we're looking for, nor do we squeeze the time that we allow people to get to know us and what we're about, I think.
And also we are developing that organisation
with those people.
With those people. So it's a test at the time of recruitment. It's a test as we develop the organisation. It's a test, of course, as the recruitment crystallises with their actually entering into employment. And that will be at different times as well over the next 7 or 8 months. Please.
I mean, two unrelated comments. One is, as we focus on the process and make sure we get the right people, we mustn't forget that actually when the commissioning board is up and running, this will be hugely impactful, hugely exciting. There's an awful lot we can do for the population of England. The unrelated comment is, and we will of course be hosting the commissioning support services as well, and there's another group of several thousand people we need to make sure, get reassurance from where they are at the moment, land in the right jobs, and that part of the process with our hosting duty happens as well. And as maybe Barbara might, how do you feel we're doing on that bit of the world?
I think the circumstances are very similar, and I think you make a very good point. We're currently appointing the VSM roles for the commissioning support services, and as with the internal board VSM roles, we are having some difficulty in recruiting. Thus far, we've recruited to almost half of the directors of the 23 CSSs. And again, a decision that, important though timetables are, these are very big jobs, and we need to ensure that we have absolutely the right people in those roles. And again, I think in the same way as with all the other roles in the board, once we see a completion of that recruitment at the most senior level, then we'll start to see roles being either transferred or matched or recruited in much greater numbers. So I think there's a significant parallel in the process, and I'm glad, and I think it's really important, because this is potentially 6,000 to 10,000 staff who will have their homes in commissioning support services, and it's absolutely key and critical that whilst those individual commissioning support units, we want to have their own identity and to have as much autonomy as is reasonable in the way they deliver services and the way they develop for the future. Similarly, we want to afford all those staff exactly the same support that we would do for any other employees.
And I mean, I think the other reassurance one gets is that although the numbers actually recruited so far are quite small, there's a multiplier effect as numbers come in, and the otherwise you would look at the the number you gave us earlier and with some concern.
I think also to add to that, some staff will transfer in, so FHS staff will transfer in, and that will be a big chunk of the numbers. So.
I think this has been a very comprehensive coverage of what we know is one of our key risks, which we have to understand and mitigate, and I know also we have contingency plans to try and ensure that we come in as planned by 1st of April. Okay, thank you very much, Joe, for that report.